Welcome back. We are answering your questions about the coronavirus and kids with Medical Director for the Children's Unit at Moses Cone Hospital, Dr. Suresh Nagapan. Remember, you can text your questions to 336-379-5775. It's right there at the bottom corner of your screen. All right, this first question asks, is it possible for children to have the virus and never have a fever?
Absolutely. So kids, even more than adult, a kid with no symptoms at all. And even kids, when they do have symptoms, might be runny nose, cough, sore throat, or like we said before, stomach pains or diarrhea or vomiting, and not have fever. So just because you don't have fever doesn't necessarily mean that you don't have COVID.
This is kind of a follow-up question. Why are kids' symptoms less severe most of the time than adults?
That is the million-dollar question. I think people around the world are trying to figure that out, of why that's true. There's lots of theories out there. One is that early on, when we went into lockdown, kids were probably more isolated than adults. And it may be that when kids did get exposed, they got exposed to less virus and therefore got less sick. But there's lots of theories out there. No one knows for sure why that is, but it is a pattern that we're seeing. Kids in general get less sick than adults.
This person says, and I'm sure you can relate as a parent, I can't keep my son to keep his mask on, especially when he sneezes. So is it okay if he takes off his mask to sneeze and puts his head in his arm and then puts his mask back on?
I completely empathize with you about the difficulty of getting kids to keep their masks on. It is tough. It feels like it's never ending. But again, we really got a role model for them and really got to convince them the importance of it. And so in that situation where they're about to sneeze, have them keep the mask on and sneeze into the mask and have the elbow up and sneeze into that. That's the safest and best way to do it.
I guess unless you're alone, because otherwise your droplets really are going everywhere.
Right. And even if you're alone, if you're in a room that other people are going to come into, your droplets are still going to spread around the surfaces of the room. So.
That's right, and they're going to linger in the air for, it could be a couple hours, right? Okay. Yep. So this person is asking, can kids develop issues with breathing or with their lungs if they're wearing masks so often?
No. So that, I know people have been talking about that and worrying about that, and it's absolutely safe for kids to wear masks. People have tested this to see if, the kids' oxygen levels go down. No, they don't. Their carbon dioxide levels don't go up. So it really is safe. It doesn't cause any lung damage and it doesn't cause any long-term problems. Really what they're doing by wearing that mask is protecting themselves and also protecting their neighbors and friends.
This person says, any concern that kids' immune systems won't build up as quickly or as strong because they're washing their hands so much and using hand sanitizer so often? I know clean hands is a good thing, but could too much cleaning be a bad thing?
In this situation that we're in right now, the benefits of washing your hands and being safe and using hand sanitizer when you need to really do outweigh anything else. And so it's never been proven that, exposure to germs is necessarily a good thing. So I think, within reason, washing hands and using hand sanitizer in the long run is going to be the safest thing.
How about this? Can kids fight off COVID better than adults? Does it depend on their age? Like, can teenagers fight it off better than the younger ones, or the young ones better than the teenagers?
There's some variability there. Younger kids under 1 may have a little bit more significant disease than school-age kids or older kids. But, kids of all age have the ability to fight it off. And like we said, more than 90% of kids who get this do just fine. It's really a small percent who get into trouble. And so what we've seen is kids in general do okay, more so than adults.
How about this one? Does COVID affect a child's sleep?
It can kind of secondarily. So, if a child's got COVID and they've got symptoms, kind of the cold symptoms that you would see in lots of other viruses. So if they're coughing and sneezing and sore throat, of course, all that can make a kid have trouble sleeping. And so that's the way, if it's going to affect sleep, that's the way that it's going to affect sleep, is through those symptoms.
Okay, but not because they have COVID, they're asymptomatic, but they're not sleeping well, and that is a symptom of COVID.
That's not a symptom of COVID, right?
Okay.
So that shouldn't be the only symptom.
Okay. All right, you can continue to text your questions. We've got the number right there at the bottom of your screen, 336-379-5775. We've got one more segment when we come back for you to ask your questions about kids and coronavirus.